Good afternoon. My name is Asanga Fernando. I'm a consultant here at St George's in South London, which is one of the busiest and biggest hospitals in the UK, where I have two main roles. Firstly, I'm a consultant cancer psychiatrist. This means I work in an integrated manner alongside oncologists, surgeons, nurses, and palliative care clinicians, looking at the mental health impact of cancer, its treatment, and people with pre-existing mental health problems. And I'm also clinical director of simulation and clinical skills here at the Trust, which means basically innovative approaches to training across the organisation, thinking about interactive training where we look at things like team working, communication, leadership, and actually how we can improve these things using technology and actors as well. And it's this second role that's allowed me to have quite a senior leadership role in training Trust staff across this organisation. The COVID-19 pandemic was a difficult and is a difficult time to train doctors, nurses and other healthcare professionals. And as a team, we've developed a very innovative training programme which we change all the time and which we ran all the time, including at weekends, all over the hospital, but also to other hospitals as well. And the key thing is that we have really changed the training needs as the needs of the pandemic have changed. So in March, first of all, we were doing a lot of training for ITU, so for ITU doctors and nurses, and for people being redeployed to ITU. We were doing that in ITU, we were doing that in other places in the hospital as well. Lots of training around PPE. Secondly, in April, we changed and we did a lot of training around palliative communication, as many relatives weren't able to visit their loved ones in hospital. And actually, doctors and nurses find it really difficult to give bad news speaking to relatives on the phone. It's a really important aspect of the pandemic, looking after the dignity of patients who are dying and communicating with their relatives, and that's really important. And then in May, we've been doing more training in local hospitals, other hospitals, mental health establishments, and other settings where staff may not have had a lot of physical health training, and preparing them for the COVID pandemic. So overall, it's been really busy actually, and but it's been a privilege seeing so many dedicated people working together. What I can say is that there are a number of positive things to take away from this, and we need to remember these things going ahead. And the most important of those things actually is that we work better and actually train together when doctors, nurses, other healthcare professionals all work and train together as a team. That breaks down barriers and it ultimately improves care for patients and families. So I think there's going to be more and more of this sort of training, and I would certainly also hope that this has really been important in highlighting the spotlight on things like palliative care and communication, and also the mental health needs of not just patients but also staff who are dealing with a number of difficult things going ahead. Often you innovate and you establish best new practice based on innovations at a time of crisis, and I think this pandemic offers us the opportunity to do that. Thank you.